Hi, good afternoon, everybody, and welcome again to this afternoon's noon meeting. Can I just check, can everybody hear me?
Yes.
Okay, I see some nods. Great. Thank you so much. In today's session, we're going to be talking about Cape Town Together, or the CANS, and we have some special guests from the CANS with us today, and so, yeah, without further ado, let's get cracking with the presentation. Can I just check that everybody can see my screen? Can you see the presentation in front of you at the moment?
No.
No.
Okay.
No.
Let me try again.
Hi, Leanne. Sorry, just one sec. Wardine, can you just switch off your video for us, please? Thanks, eh?
Thank you. For some reason, I'm not able to share my screen, but it does look like I have permission. Am I right to think that you can't see my screen now either?
We could see your screen, but we could actually see the teams and not the presentation.
Why is that? Okay.
And also, how many screens are you running? One or two?
I'm trying just to run one. Let's see. Okay, hopefully this works. Do you see my presentation now?
Yes, Leanne.
Oh, yay, wonderful. All right, good. All right, so between technological hitches and load shedding and data issues, let's see how we do, but let's get started. So as I said, today we are going to be talking about Cape Town Together, or the CANS. I'll start off with a very brief overview, and then we'll hand over to Pam, who's with us today from the GUGS CAN, to briefly tell us about the work she's been involved in. And then after that to Ricochet, who's from the Ocean View CCC. And then depending on how we do for time, I might do some quick closing reflections, but mostly we want to leave lots of time for questions and comments or inputs from others who have been involved or who have questions for any of our speakers. So thank you all for being here, and let's get started. So I think many of you heard about the CANS or were involved in the CANS during especially the kind of initial phases of the response to the pandemic last year. What it is a group of people very loosely connected through a network known as Cape Town Together, but made up of many individual CANs. And these autonomous groupings are neighborhood-based and self-organizing. So it's not an organization, it's not an NGO, it's not a state-driven initiative. Instead, it's a very loose, informal, some would say, connection of people who are self-organized through CANs or the Community Action Network. It was catalyzed by a group of community organizers, social activists, and public health folk about 10 days before lockdown. I was one of those people. Others on the call were involved as well. I know Eleanor is with us today. And essentially, the thinking there was that what we wanted to do was have a very have a wide-reaching collaboration between people who had been organizing or doing activist work in Cape Town for a long period of time to build on those existing networks. While the kind of actions are very local, they are also connected through the broader network. And the idea there is that we want to draw on one another's collective energy and collective wisdom that is generated. So, as I said, it's a very bottom-up networked response. It's an adaptive network made up of these self-organized mutual aid groups, is another term for them. And that this bottom-up, very dynamic way of working enabled a very high level of responsiveness to local needs, because of course, every part of the city is different and faces different challenges. So in the pictures here, For example, up top we have Mark in the Lavender Hill can, who started feeding kids on the field on Bludder Street when the schools closed down, because many kids living in that neighborhood were no longer receiving their one meal a day. On the bottom right there, we have some safe distancing lines spray painted on a pavement in Salt River outside one of the corner stores in an attempt to keep corner shops safe and open. Important thing was that CANS worked with existing and trusted members of community groupings, but didn't represent their specific organizations. Instead, it allowed people to, when needed, work beyond their mandates, but come together in these new groupings specifically to respond to the pandemic and some of the emerging challenges. So what did CANS do? Lots and lots and lots of different things. In these pictures here in the top left is Nceba in Gugs painting some safe distancing lines outside the clinic. In the bottom left there, we see Ella, who, along with colleagues in the Woodstock can, started a mask making project. Bottom right, we see another spaza shop sort of intervention that is it's in Southern Hills actually, and that's Frankie painting some lines on the floor outside. And then top right, we see Mzi and his colleagues from the Langa can, who set up a bicycle delivery scheme for elderly folk who were unable to collect their medicines from the clinic. So as you can see, a wide range of different activities depending on what was needed, but loosely all were focused around COVID awareness and education, in many ways addressing some of the fear and stigma that we saw in the early days of the pandemic and still in some instances now. And then some practical things like distributing flyers, etc. There were also some kind of initiatives to get water to informal settlements. But I guess what I'm really trying to put forward here is that there were many different things, and those the activities depended on the cans, who was in that can, and what they saw as the specific kind of urgency in their neighborhood. So with that, I will hand over to Pam, who will tell us about the work that she has been doing in the Gugs can. So Pam, over to you. You'll have 15 minutes, and I'll give you a 5-minute warning when you're nearing your time, and just let me know when to move on to the next slide. Great, thanks Pam. Over to you. Pam, are you there? I do know Pam was on the call earlier. Let me just check the list of participants again.
She is coming on again.
Thank you. I can't see the participants with the screens. Thanks for the assistance. Pam, can you hear us?
She's still being admitted. Just give it a minute.
Thank you.
Sure. She's on now.
Wonderful. Thank you. Pam, you're back. I'm sure struggling with network issues. I was, if you didn't hear, just handing over to you to continue with your portion of the presentation. So over to you.
Can you hear me?
Yes, we can.
Okay. Hi, everyone. My name is Pamela Silwane, and I am from the Ricochet can, and I'll be telling you how we started our can in Guletu. So 2 days before lockdown, there was an announcement that lockdown was going to happen, and we were in the library and part of a group that is an unemployment movement where we focus on helping the unemployed while we're also unemployed. And then when the president said there were going to be a lockdown, it hit us like, what were we going to do? Like, how were we going to survive lockdown? being already unemployed, and the only means to food or necessities was hustling. So we knew nothing about COVID, and it was confusing for us and for everybody else that we knew, as much as it was explained on the television. But still, we still did not get COVID ourselves, and we were like, okay, what do we do now? If we don't know what this COVID is, how it's going to affect us, what do we do? So we met with teachers in our areas, with our street committees. We called in a meeting to decide how are we going to respond to this pandemic that was about to fall on us. And we thought it was just going to be 3 weeks. So what do we do? Luckily, we joined Cape Town together, and that is where we found the foundation on spreading the information that was needed in our communities, the information that we didn't know, because the information that was being passed around in our community was not fact checked. Everybody had their own opinion what COVID was, and once we were part of Cape Town together with information that was fact checked by doctors, we were confident enough to go into all parts of our communities to tell them about what COVID was. And the first thing was, how do we protect ourselves from this virus? So it was like, okay, sanitizers. We need sanitizers to sanitize our hands, we are told. And then we're thinking, not everybody can afford sanitizers. What do we do next? So the group again, Cape Town together, they come up, okay, soapy water helps kill germs. So that is what we then ran with. Okay, so people needed to know that, people were historically going to shops to go buy sanitizers. So we're okay, let's go everywhere and tell them there's another way. If you can't afford, there's a way that everybody can kill germs of this COVID. So we went to informal settlements, we went everywhere. We then also got flyers, pamphlets from the Cape Town Together, where we could teach our communities about COVID, how to protect yourself, how to protect your families, and living in a 1 bedroom with 8 people in a shack, that was impossible to do. But we had to find ways on telling people, informing each other, how best do we keep safe during this pandemic. So we also learned along the way, as we were busy teaching, that we also taught each other as well. So within that, we knew that, okay, what next? Food was going to be the biggest thing that people were going to need, because now domestic workers will be told stay at home, stay at home. So if you were selling things on the train, you were no longer able to hustle for food. So we started off with vouchers and food parcels. But when we did the food parcels, we were scared that maybe we would contaminate the food parcel while passing it on to the next house, to the next granny, what so forth. So we decided, okay, let us do vouchers, because they were going to be less viruses spreading all around. So we did food vouchers. While we were doing food vouchers and sending it out to everyone, we then thought, okay, so 5 to 10 houses get voucher this week, then the next get vouchers the following week. What happens on the other week when a person does no longer have food? What do we do next? So we're like, okay, let us come up with a solution that is going to help everyone. So Gogo, who's my mom, loves food, loves cooking. So we decided, okay, let's open up a community kitchen where people can come in. So the first day she opened up a community kitchen, 700 people came that one day. And then we're like, okay, so there is a need. A restaurant owner, Tulani, who used to have a restaurant but was closed down. So he also decided, okay, let me also open up a community kitchen so that people can spread. So we ended up having like 38 community kitchen feeding 4,300 people every day. And the amount of people that would be outside was so scary. But because of the information we had, we were able to handle everyone on the line, sanitizing them, allowing them to wear masks. And when they did not have masks, they would come up with different ways of wearing scarves and all over just to protect themselves so that they can come in and get food. So that's what we did. And also we had WhatsApp where all the kitchen leaders and volunteers would sit and share information and even share resources. If one kitchen did not have food, they also know that kitchen A and kitchen B shares food so that everyone in the community could eat. So that is one of the we did in Gugulekan. So there were so many things happening that we decided to respond to as we were in the lines. People would start asking questions. People wanted information, and people like pregnant women would ask us, I don't have clothes for my baby. I'm about to give birth. I don't have nappies for my child. I'm about to give birth. So what do we do? Because of the network that we had and the relationship with our partner in Ken, we're able to come up with the resources that would close the gap that people were having. You know, people were coming to tell us that I have an abusive partner and I stayed because I needed food, I needed clothes. But since now the kitchens are providing so much more than food, I am able now to come to the kitchen and rethink my life, rethink how I want to live. And I've left this abusive relationship. So we reached out to the network of many and would help. And what also helped was that we made partnership within the community. So the kitchen now started being so much more than a community kitchen. They were being a hub of information, a hub of where people know that if they wanted something, they could come. If we have it, then we would give it to them. At the same time, because of the doctors of Cape Town together, because of the network, because of everyone, we always made our kitchen free. We even had this challenge a year ago where there was a question of how to keep your kitchen COVID free. And because of the information that we had, we knew how to keep our kitchen clean so that people would not get sick, because that was the major fear that has always been on our mind. What if we're cooking and the people get COVID? But we've never had someone in a line that says, I have COVID. We never had a group that tested like people are being affected. So being part of this network helped us to ensure that we were feeding our communities, we were teaching our communities, and we're keeping them safe. So the useful thing now about the kitchen is the vaccination drive. Because of the people that we are having in the lines, 3,400 people every day within the different kitchens. So that is where the people are at. So we were able to teach them about what this vaccine is. And we also registered grannies, the kitchen staff, and some of them have been vaccinated already. And the powerful thing of this kitchen is that people are there. These are the places where people meet, talk, get information. And I have the story of Ntlantla. Ntlantla once saw someone carrying a porridge and asked, where did you get this? So this other lady says, Gogo's kitchen. So Ntlantla came to the kitchen one day and he was like, I'm hungry. He got food. He went back home. So he came back the following day. He was like, no, I want to volunteer so that I can get food later on for evening. So he came and he was washing pots every day, up to the point we asked him, Lantla, what is your qualification? He was like, no, I'm an accountant. It was like, okay, we need help in the office, in the Google office. Come help out, come volunteer. He started volunteering at one of our organizations called Organizing for Work. Or after that, within 6 months, Nhlanhla was helping the unemployed people, registering them to a point where there was a competition where one person was going to be hired in Guguletu to be a coordinator of OFW. I'm telling you now, Nhlanhla is one of the coordinators of Guguletu, of OFW, meaning that there's opportunities also being in these hubs and the value of being part of these hubs. So yeah, so one of the things that we've learned so we had so many things because there were children in the lines, there was everything was locked down. So we looked at, okay, what do we do to keep children off the streets? So we prepared kids to children on the line. We looked at our network through what else can. So we started teaching children about environment, where we partnered up with an organization called Preston Earth Collective, where we would clean up our neighborhood because there would be dirt everywhere that would be dropped by adults. So we're like, okay, let's teach the children so that the children can teach their parents. And then what we did, so we would have like every month would have a cleanup. Then on the mid of the following month, we would have we would take the children out. We would take them to the river, where they would see where the litter would go to. So that we would take them on hiking. So those were the things that we did in Guguletu Can, and we also had sanitary drives where we partnered up with Hope Africa, where they would give children dignity packs because now the parents were not working, unemployment is a problem. So having money to fill in these needs is always a problem in a township. So those are the things that we continue responding to. There's always a fire happening in Guguletu all around. So each and every time people would come to us and we're like, because of this big network and the generosity and the love that is within there, we would share resources, beds, covers, clothes, anything that was destroyed, we would try to rebuild or give back what we could. So what did we learn within everything that we were doing? We learned that we have our own solution and we don't have someone on top telling us what to do. We also learned that kindness spreads viral kindness because we could not do this without the power of the kindness that is all around the network. We also learned that collaboration is the key. You can't do something when you do it with other people, it's more powerful, it's more effective, and you get more resources and you get more hands into doing something. We learned that building relationships are important and a network of relationship build trust. So you can't. What we learned that is that you have to have a relationship with someone in order for them to trust you. Once they trust you, there's an unlimited things that you can do with this person because now you already built, then you have to help the community. So also learned that you need to flip
You were breaking up quite a bit there, Pam. Are you still there?
hear me.
Yes, you're back.
Can you hear me?
You're back.
And did you hear last?
The last bit we heard you talking about was about flattening hierarchies. So you just got cut off just now.
Okay. So we learned that each and every voice matters. You know, each and every person's opinion matter, and the with collective voices and opinion, you are able to make a change because everyone has a has a role to play. Like myself, if I'm an unemployed person, I can't do this, I can't help my community, then I would have been wrong, because now I am part of the Guguletu Can, and because of no hierarchy, I was able to do my part, and everyone else was able to with solutions for our problems. And we also learned that we need to look after each other while we do this work and take turns holding the space. We've been doing this for more than a year now. So obviously there have been people that were tired, people that needed to take a break because it has been a non-stop, because we thought that it was just 3 weeks. 3 weeks turned into a year is turning to, I don't, more than we're going to a second year. And within that space, you lose volunteers. We create a space where if a volunteer goes, then they are welcome to come back. We don't hold the person to saying that you were here, you were gone. So that is what I mean. So yeah, that is us, Guguletu Can. I don't know if I left anything.
Thank you so much, Pam. That was great. I must say, one of my favorite memories from early on in the pandemic is having a delicious lunch outside in the sunshine at Goldberg's Kitchen. Thanks so much, Pam. We're going to wait till the end for questions. So I'm going to hand over to Ricochet now to share a bit about the Ocean View CCC. And after that, we will take any questions for any of us. Thanks so much, Pam. Over to you, Ricochet.
Thank you. Can you hear me?
Yes, loud and clear. Go for it.
Good afternoon, everyone. I'm Ricochet from the Rensburg. I'm from the Ocean View Can. And in Ocean View, a branch from the Can network, we set up the community care center, preferably or for the use of the people in the area, for not just having a home away from home and not having to self-isolate at home where you might need put other people in danger. So why we thought of the community care center and why we thought it's important. In the beginning in the Ocean View area and probably many other areas, fear and stigma played a big role. And this allowed people to have trust issues, I guess, with government and with just places that they were offering. And with this, people didn't want to move out to the neighborhoods. They didn't want to move to any hotel, and they had the fear of not coming back. And then we decided with Leanne, Brady, she came up with a concept that they use in Sierra Leone to have like a home away from home, a care center in the community where we could help them and not let them go out of the community, but at the same time not stay in their houses where they maybe 5-6 people and then they put other people at risk. And these were the reasons why we thought a community care center in the area would help. Yeah, thank you. So where we got started, it wasn't easy. We had to obviously get help, and that's where the volunteers came in. I met the guy, his name was Earl Mentor. He lives in Ocean View and he does youth programs. And luckily for me, he could ask his volunteers to come around, and we had a bunch of volunteers. I think we were 9 at the beginning, and then we worked around that, and people came and went because of our struggle to find a venue. We went up and down, we went to government venues, city facilities, spoke to people in province, national, and back down to city. And no one could offer us this any venue, even in our area. We had the soccer club we wanted, but the venues were all we were all told that it's not going to work. And yeah, we didn't really have anything to back it because it was a community thing done by the community for the community. There was no real insurance that it was going to work. So I guess they didn't want to put everything into us and give us a facility and then it doesn't work. So that took a while, and we lost volunteers through that and gained volunteers. Eventually, we got one of the volunteers offered the house. She had a space open on top, which had two bedrooms, a bathroom, a kitchen, and the lounge. And initially, we wanted to use the top and the bottom and then divide the house. But then with donations and stuff also not really coming in that much, we decided to just use the top area. Then getting bedding, and we got a lot of donations at some points, and then some points it was a bit quiet. But altogether we managed to get enough bedding, enough yeah, beds itself, mattresses, and yeah, we got towels, we got pillowcases, and all of those things to make this place a home away from home, make the CCC exist. Um, we only ended up with the 2 bedrooms, where we used one of it for the actual residents, and the other one we kept the volunteers overnight, just to keep an eye on the residents. And before all this could happen, we had to run our training, with the help of the CAN, and we had WhatsApp groups, and we had a CAN health group where we put together basically a training manual for the CCC, for the volunteers, so that they don't get COVID, they don't go home and give their families COVID. So we did that training course. I think we did it over 2 or 3 days. The volunteers did it. They learned how to put on PPE, on and off PPE, and make sure that they interact with the residents on a safe distance and all of those when they're taking the sets and those things. So yeah, the start was rough, but then we eventually got through it. We can go to the next slide. Thank you. And then when we opened up, initially we also hesitated a lot. We had the things, and we didn't have guests, but we were also, well, not guests, we didn't have any residents at the time, and we were advertising it, but we were also, like, at looking at it now, we were a bit also fearful of actually just initially starting it. We went around first to the neighbors before we opened the door, and we had some pushback, but we had a lot of support, mostly support. It's about 70% of the neighbors support us, and then there was 30% who also had their own personal feuds with the area. So it wasn't really about the CCC, but they made that part of it. And then setting up the network, we had a WhatsApp group with a couple of doctors on that gave advice, that helped us through the process of looking after the residents. We had the clinic that supported us. They gave us medical waste bins. They checked in on us. If we needed anything, we could phone down. And then the system helped us just look after the residents and make sure that while they're in our care, because we are not doctors or nurses or anything, that we have a protocol if something goes wrong, how to act to that and how to approach that situation. And then the opening day we had an opening day, and we cut the ribbon as in the picture, and the Minister of Health was going to be there, but something came up and she sent someone to say that she wouldn't be there. But we had a lot of other city guys there, and I think it was a PA that was there, and we spoke to him, and it turned out a success. We had lots of people there that afterwards gave some sponsors and helped us, and whether it was food or just a small money donation, whatever the case. So the opening day helped with just showing the community what we're really trying to do and showing them that it could work. We can go to the next slide. Thank you. And then the running of the CCC, as it says, a home away from home. We had I would call him our personal chef, but also one of the volunteers who loves making food. He's got his own creche, and he's a cook, and he cooked for us, and as it says there, delicious meals, and he always provided meals on time, made sure they had the meals, and there was always something extra, something like a dessert or something like that. He would add. We only had 3 residents. We didn't get that much, but in that time we learned a lot. And in the time, we had 2 residents. The family could drop off stuff because it was in Ocean View. It made it convenient. It made it convenient as we wanted it to be a home away from home. They could stand outside and see their families. It wasn't like they shipped away to a hotel. So the purpose of the CCC, eventually we could see when we had our residents there and the way things went. And like it says there, the way through windows and things like that. As I mentioned about the clinics, Sister Petra helping us with the medical waste and things and checking up on us. And then we took sets, which we took thrice a day. And with the one resident, the sets was low, and we took the protocol that we were learned. call the necessary people, and then eventually got to the hospital. And then the hospital, or the doctor at the hospital, told her to do some breathing exercises, and the same advice came through on the WhatsApp group from the doctors we had. And with that, she came back to the CCC for the rest of a self-isolating time. And then from there, we helped her with the breathing exercises. We got the balloons, we got the straws, also advice we got from the WhatsApp group. And in like 2 days, SAT's oxygen went up. And for us, that was amazing, because just following the protocol and doing what we were trained to do, we could help that person, and where they would have been at home and not getting that help. So that process, seeing it and living it, it's amazing. And then, thank you. And then, so what we learned, I mean, there's 7 points there, and there's many more that I probably will forget at the moment, but just to go through the ones we have here. Flexibility, learning, because the pandemic was something none of us ever faced. We had to stay flexible. Cementing things wouldn't work. Saying, okay, we're going to do this at that venue, and that's the only option, that would have made us never get anywhere. So we were always flexible, moving around, taking whatever we could. Whether it came to donations, even the venue was a person's house at the end of the day, one of the volunteers. So staying flexible was one of the lessons. Staying open, and this helps a lot, because you can learn from the smallest things you don't expect to learn from. So staying open to new experiences, help from outside, and not just using your pride to, I want to do this and help my way. Yeah, just being humble, and taking in help from wherever you can, and seeing the community come together, it helps. That's one of the lessons. So just staying open to new ideas, and then building a team. Yeah, learning to put the volunteers together and keeping them there, keeping them happy, keeping them involved. It taught me that lesson, how to get, and it's all random people. It's like, I only knew 2 of them, and the other 6 of the volunteers I met doing the project, and having to keep them there, and being with them every day. Yeah, learning how to put a team together, and just what it needs, what it takes to do that. And then patient care was a big lesson for me. Being there every day, being there 10 days in a row with one patient or 2 patients at a time, which we had at one point. Seeing in on them, it's not just about dropping their food and walking away, or taking their sats and taking their oxygen, or whatever the case. Checking temperature. From a distance, we had conversations with them, see how they felt, how's the day going. In the beginning, they had body pains. And then as the days went on, we spoke to them, and we could hear from them, they're feeling better today. They were more active. They even started cleaning some parts themselves, closer to the end of their stay, where they told us, no, stay away, we'll clean this, we'll do that. So yeah, just patient care from, I do emergency response, and I'm only a level 3. So that's much different from the ambulance work we do. It's just to patch up someone, and then off they go. This is actually staying with that person and actually caring for them. And then the CCC, we learned, is more than just the building. It's not just the building where we could provide the home away from home for that residence. After that, we branched out, and we started from the CCC platform, using that to give bread, deliver bread in Ocean View. Because we didn't have a venue anymore, and Ramona had to get the house back, and her parents back to the top part, because that was the parents moved out there so that we could use that. Then we started taking the SATS monitors, and whatever thermometers we could have, and whatever care pack we made, and taking it to people that needs to self-isolate, with a poster or flyer telling you how to do your SATs, and what to do, and how to self-isolate in this time at home, if you have like 5 to 6 people in your house, for that matter. And that was the other support. And up to today, we're still doing whatever we can to support the community. So the CCC keeps evolving. We want to do a winter drive with clothing we got from one sponsor. So just people who needs clothing for winter, we're going to do a winter drive at the moment. And then the last one is just the bottom-up approach. Pam also mentioned it. Just taking the ideas from the bottom and not letting people dictate from the top. Like if government told us that this is the venue, you do it this way, that way, it would have been, I think I would have lose more volunteers because it would have been more stricter. We would have to do it in a different way. And that's besides the actual COVID regulations that stay strict. We have to obviously abide by that at all times. But it would have just been top down and you do this when we say, and that wouldn't have worked. This way worked much better. The volunteers was free to come and go when they needed to, in the bounds of the rules and the regulations of COVID. And that way I had the volunteers throughout the 3 months I think we were open. And then we had to close because Ramona had to get the house back. So yeah, the bottom-up approach was very helpful. So yeah, that's the CCC in a nutshell. Thank you.
Thanks so much, Ricochet. Let me see. I'm going to stop sharing now. Hopefully that's working. Thanks, Ricochet. That was such a great overview and so much granular detail of what it really took to get the CCC up and running. All right, with that, I am going to open up for questions, comments, for any one of us, or for any additions from, I'm sure many folks on this call were involved in the CANs in a range of different ways and may want to share. So yeah, let's open up for questions now. Lucy, please go ahead.
Thank you that's a good picture of my screen. Thank you very much indeed. That's really fantastic to hear about the CAN's experiences and to understand the level of detail. That's really helpful. I wondered to both Pam and Ricochet, if you could reflect a little bit on the experience of the CANs and how it was similar or different to other experiences that you've had before of community level organizing and action. Were they different or were they similar? Was there something particular about the CANs experience? I just wondered how they are, how you experience them in relation to the other work that you've been doing in communities. Thank you.
Okay, I can go first. So I'm also a volunteer for EVS, which is a organization in the area which do medical and fire, wildfire. So with that, we do a lot of, like I said, first responder work, and also when we live down the road from Massey, so if it burns there, we always do relief work, go to Living Hope, pick up blankets and drop off stuff. So that work is kind of just drop off. You don't really meet the people. It's just drop off point and then you leave. This has actually been more physical, or more intimate, if I can put it that way. We are actually on the ground with the people, seeing their needs, understanding what they need, and then having to help them that way, instead of just looking and painting everyone with the same brush, if that makes sense.
Thanks.
Thanks, Ricochet. Pam, is there anything to add from your side?
Yes. So the difference with the organizing that I've had before the CANs were, because I've been part of Organizing for Work, where we would meet in libraries, we would meet unemployed people, that we would share our thoughts, our ideas, and help each other out finding work. So I would say the level of organizing was just in a scale of meeting those people then. And even though we had many branches, but we did not have a way that we all were together and knew what was happening on the other side, what the struggles were. And the other experience I had was I would volunteer at schools, be an admin or a teacher assistant. So the difference with Cape Town Together was the network. The network is huge, and the relationships, you know, with Cape Town Together, we built relationship with people that we never knew. Like within a year, the friends, the people that I call my friends now, I've met them through the network. It's the network, it's the relationship that is different, and the connectivity. You know, if someone is in Paarl, is in Joburg, is in Cape Town, is in Sea Point, I'm in Kukuletu, Nyanga, Kailicha, we are then all able to meet and talk and build relationship, and share resources, and we are there's information on dealing with different things, and the connectivityness and the type of information that people have that you need. So for me, that would be the difference, is that the level of organizing within Cape Town Together was huge because of the huge network that we had, and the intimacy that you would have with someone that you never know, but you then know and build, and then you had built relationship with. So yeah, I don't know if I answered you, but yeah, that's my experience.
Thanks, Pam. Yeah, that's great. I mean, I'm remembering one of the ways in which we used to talk about that is how, as a network, we would move at the speed of trust. And I think that really speaks to the ways in which the relationships that we formed and continue to nurture throughout the response are the basis for this work, which felt to me to be quite an important difference to some of the work I've been involved in before, at least. Miriam, please, would you go ahead? I see you have your hand up.
Yeah, thanks, Leanne, and thanks, Pam and Ricochet. I have two questions regarding two quite different aspects. The one is around community projects and safety, particularly against crime, how the CANs have experienced this differently to some of the projects that we've seen that communities have started and have been vandalized. So how has this been any different with the CANs? Have you experienced any crime in that sense? So that's my first question. And then my second question is really out of interest in the spirit of volunteerism, how one motivates within communities where there's scarcity, and what drives it where people already don't have basic needs but are still willing to volunteer. How does that work, and what are the things driving that within communities? Thank you.
Great, thanks so much for those. Pam, go ahead.
Okay, so when it comes to volunteerism, so do you remember when we said that the things that popped up during COVID, when the pandemic was high, were things that were already affecting our communities. So people volunteered because they knew that these were the things that were affecting them. So when people volunteered in the kitchens, how do we motivate them? Because we know these people are volunteering in the kitchens, we know that they have to go home and eat. So we would provide food so that every day a person has food, so they will never need food. That's one of the ways that we incentivized volunteerism. The other way, when it's unemployment, you know, when you volunteer, parts of the project that we're doing, you don't up your CV. So that's another way of encouraging youth and the youngsters. It's going to go upon your record when you go to university and high school. And when it comes to crime, if you see the people that are coming into our lines, you know, because crime comes of we feel like that's some of the reason why some of the people are going into. So we have never had crime happening at our kitchens because the people knew that that is where they get their food. But with environment, we're still working with the community. Sometimes we would do cleanups. Sometimes the community would dump again. So we'll be working with the communities where there's a dump site. We will be able to turn them into beautiful places where they'll also see this is beneficial to everyone rather than throwing and living in a dirty place. So yeah, those were my thoughts.
Thanks so much, Pam. Ricochet, do you have anything to add from your side?
Not much. From the crime side, yeah, in Ocean View there wasn't. There's a lot of shooting going on in the area. But at the time, at the peak, and at basically last year it was quiet. Like Pam said, even when we had a soup kitchen at my house, there was gangsters in the line, and they didn't really care about anything, just wanted the food and then went on. So I didn't see crime playing too much of a part in our setup this side. And then, as I said, in one of the lessons we learned, the bottom-up approach, keeping the volunteers happy and why they would volunteer is listening to them and actually using their ideas. I mean, every idea is not going to be able to be used, but listening to them, understanding why they want to do that, and interacting with your volunteers on a more personal level than just hello, morning, you here, do your job, bye, see you tomorrow. And that didn't work. We actually had to sit down, understand each other, why we're doing it. And the more we could speak about that and understand where each one is coming from, the more we wanted to do it and be in the space with each other. So yeah, that's just from my side and my experiences. Thank you.
Thanks, Ricochet.
Awesome. Thank you. So just commenting on that, Leanne. So I mean, there's so much we can learn from that. Really, firstly, that those primary needs of food are being met, your crime levels go down. And the second is people are being seen. And when they're seen, and this can apply to any environment, they're willing to do good. So thank you for sharing that and the opportunity.
Thanks, Miriam. Absolutely. I mean, I think the other lesson is when we think of public health responses to a pandemic or anything really, it's important to start with where people are and what is the most pressing priority. And I think this was a big difference as well. So CANs weren't sort of primarily focusing only on COVID. Instead, they were focusing on making sure people's basic needs were met, that their largest concerns were being addressed, but doing that while sharing COVID information. So having sort of a two-way exchange of ideas about how to keep each other safe during the pandemic rather than control of the pandemic itself. So I think that's another important public health lesson. Linda and then Maylene. Go ahead, Linda. Linda, are you there? You are unmuting, but for some reason we can't hear you. Yeah, no, sorry, Linda, your mic seems not to be working. Maybe you could type your question in the chat box if you like. And Maylene, let's go over to you.
Thank you, Leanne. Can you hear me?
Yes, loud and clear.
Yeah, I wanted to ask maybe of all of you, but to Pamela and Ricochet, and thank you so much for the presentation. The whole response to the pandemic, wave after wave, was quite an exhausting process, and quite often the caring for the carers is forgotten. Such a process. And how did you care for yourselves to be able to keep on going day after day? Things were really rough at times.
Okay, I'll go first. Again, I'm going to come back and say that what pushed me, what cared for me, was the relationship in this network. So on May, I think it was May, I got COVID. Like I had signs of COVID, and then within this network, a friend said, "Come and stay at my cottage, and I'll look after you." And she did. And the level of people caring for you within this network is amazing. You know, you are able to rest at times, then other people hold space. And when you are feeling tired, you have people that you can talk to, doctors that you can talk to, psychiatrists, like different professions where you know that whoever you're going to talk to is going to actually talk and calm you. And even within our own WhatsApp group, there is a space where you are being cared for. When people know that now you are being overworked, they tell you, sit down, rest, are you doing okay? So they would have this check in with Leanne, where we would talk about so I felt that was like therapy, where we would talk about our days and reflect. And then you knew the following week, you knew what you were going to attack, you knew what we were going to let go of, and you knew if you wanted to rest. So for me would be this network again. What it offered me that safe space to care about myself, even at times. Like I'm a get goer. I'm someone that likes to do, but then I have people that remind me, slow down, relax. You're going too much, take care of yourself. So yeah, that's how I still continue going on, because of the relationships that I have and the people that are within my network.
Thank you, Pamela.
Thanks, Pam.
Wonderful.
Thanks, Nadine. Rico, last words from your side?
I think Pam said it all. Yeah, the network, as Pam said, I'm not gonna repeat all of that. I totally agree with Pam. And then just my family at home also, the support I got, and then also friends around, understanding that this is what it is. I'm doing this. Help me, and they weren't in my way. I could come home and they didn't question me. You busy with the COVID people, or you doing a CCC center, the community care center? Aren't you going to bring it home? They were all supportive, and then through that, I felt like always going. Like Pam also said, I always just keep going, and then get reminded every now and then, slow down. Think you're gonna burn out. So yeah, just your the people in your space, I think, is important. If you have people that's just going to be in your way and negative, I don't think you're going to want to continue very long. But if you have a strong support structure, I think you could go forever. Thank you.
Thanks so much, Ricochet. We are at 1 o'clock, so just a few quick comments in closing, and then we'll all go. Linda, I see you popped a quick comment in saying how you were involved with some of the volunteers with COVID and contact tracing, and that CANS were involved in some quarantine and isolation and food security there as well. And you were just thanking everybody for their contribution. Thank you for that. Maybe on the care part, Maylene, one of the things we did is we also created some structured online spaces where we specifically met to look after one another and to laugh together, because the work was difficult, remains difficult. And that's one of the things we really foregrounded, actually, that it's not the work that matters, but how we look after each other while we all do the work that we need to center as in an intentional way. So at least that for me was really helpful. Okay, well, this brings us to the end of our noon meeting. Thank you very much to everybody for attending. Pam, Ricochet, thank you so much for sharing your experiences from your CANs. Of course, across the network, there are so many stories like these. In the end, there were 170 CANs and more than 20,000 people involved in the network. And I think in ways that demonstrated radical acts of solidarity across a city that is very divided. And so I think that was one of the other big focuses of the network, was organizing across race and class lines in a city like Cape Town is of critical importance. And I mean, during pandemic moments, the narrative is often that things fall apart and it becomes, man eat man. But I think really what we saw is people coming together in the most incredible ways to support one another through the pandemic, being a really important part of the overall societal response, supporting government responses in a range of different ways, but a lot to learn there. We could have a whole session on what worked and what didn't work in collaborations with part of the formal sort of government response, but also many positive collaborations there, hopefully in future. CANS are currently involved in the sort of social mobilization component of the vaccine rollout, and a range of possibilities are being kind of experimented with there to figure out how to continue working with informal groups such as CANS, but also to find ways to speak to that volunteerism point, to find ways to resource CANS appropriately, because of course just relying on volunteerism is not okay. All right, and with that, thank you everyone for joining, and have a lovely rest of your Thursday. Bye-bye.
Bye.
Bye.
Yeah, thanks so much.
Bye, everyone.
Bye all. Thank you very much.